ask you a question.
Okay.
Hi there, Randy and Rita here from Team Synergy. We're coming to you today from Rita's backyard, or I'm here at the Synergy office. We just wanted to check in, and we've got some questions for Rita about how folks can be managing their blood sugars from home when they are sick. So at first we'll talk about general sick day management, learning what that's all about for folks with diabetes. And then a little bit later, we'll get into some COVID specific stuff for you. So let's say hi to Rita Shearer, our registered nurse and diabetes educator.
Hello there.
Rita, thanks for doing this with me today. I know being on video isn't everybody's favorite thing.
I'm glad to be here.
So first, let's just say in general, you and I talk about sick day management. We know what that means, but what would constitute an illness or require someone to practice sick day management?
Well, sick day routines are when life throws us a curveball and we wake up and we notice that something's off. It could be off because our blood sugars are unusually high, or maybe I'm having symptoms that I'm coming down with something. A general cold, if I wake up with a sore throat, the sniffles, fever, and the fever is considered 100.4 or higher. So, of course, any episodes of nausea or vomiting or loose stools, all of those would be reasons to consider starting a sick day routine. So it just means I'm going to take care of my diabetes a little differently for the next 12 to 24 hours until I determine if this is an illness that's going to be with me for a few days or if it's just something that needed a temporary adjustment.
Okay, perfect. So it sounds like whether you just feel like something's coming on or you're a little bit sick up to full-blown sickness, we're just paying a little bit closer attention.
Yes.
Okay. So if I am getting sick or coming down with something, what should I have on hand at home?
Well, I think what's helpful is to have some fluids available to consume. Know that especially if you are having nausea or vomiting or not eating, the most important thing with diabetes and illness is that we maintain hydration. So having plenty of liquids available. Some people like some carbonation liquids when they're not feeling well. So some regular 7-Up available. The clearer liquids tend to be easier on the stomach than the colored or cola liquids. And you would be wanting to be sipping on those regularly throughout your day. They say at least a cup of fluids per hour if you're not eating.
Okay. So hydration is kind of number one. And then if you're not able to eat, something that's also going to help you maintain some blood sugars.
Correct.
Okay. How often should I check my blood sugars in those cases?
Well, a typical blood sugar testing schedule usually coincides with a meal schedule, but they do recommend we test more often when we're sick. So what's usually recommended is every 2 to 4 hours around the clock. And more frequently if my blood sugar is above the target range, which would be 200 or higher.
Okay.
In addition to that, you also want to start checking for ketones, because that could be the other thing that happens when folks with diabetes get ill, is they start to develop ketones in their body that can become troublesome if they aren't treated quickly.
Okay. Now, is that whether someone has type 1 or type 2 diabetes, they can both get ketones?
Well, we used to say that only type 1 diabetics gut ketones or develop diabetic ketoacidosis. But we're now finding, especially with some of the newer oral medications that are used in type 2, that it can really happen to both types. So on an illness day, especially if blood sugars are 200 or higher, having access to at least urine ketone testing, which is the little bottle I'm showing you here, to make sure that I'm still safe and that those ketones aren't developing.
Okay. What's the difference between blood ketones and urine ketones?
That's a very good question, Randy. So, urine ketones are the most common way that ketones are measured. However, it's not what I call real time. So, ketones have to build up in the blood and then they spill over into the urine. And so once you can detect ketones in the urine, it's been going on for at least 6 to 8 hours.
Okay.
Now, we can also check blood ketones. It's just like a glucose meter, only it's measuring ketones in the blood instead of glucose. And that's considered real time. What's happening right now. So for younger folks or folks who have other chronic illnesses or more frail, doctor might want blood ketone testing so that we can treat it faster and not wait till it's built up and spilled over into the urine. But the difference between the two is also cost. Know that blood ketone testing is not cheap. A strip to test ketones costs about $7 for each test. So urine ketone testing for most people fits the bill. It's relatively inexpensive and still can let us get the information we need in a timely manner. But one of the other issues with urine ketone testing is, let's say that I am getting sick and I'm dehydrated. One of the first things the body does to conserve fluids is to stop making urine. So if you can't get urine to test, you're going to struggle with being able to get the information you need.
Okay. So most folks with type 1 diabetes already have supplies on hand for checking ketones, but those with type 2 might want to have this conversation with their doctor and having some strips on hand at a minimum.
And know that you can buy urine ketone tests over the counter.
Okay.
They're relatively inexpensive. You can get 50 test strips for around $12.
Okay. Will you talk a little bit about taking medications and taking insulin when I'm sick? Should I still do that?
So, if you are having nausea and vomiting and take oral medications, you'll want to contact your doctor about what they want you to do for that day. As a general rule, though, if we can continue our medications even on illness days, that is preferred over stopping them. The reason for that is illness puts a more metabolic demand on the body. So usually blood sugars are running higher when we get ill. Randy, it's raining.
Just go with it.
So, okay, as long as it doesn't start a downpour and you see me dive for the inside. Okay. Although it's going to come. I can tell.
We'll talk fast.
Okay. Are you sure? Okay, hold on. All right, keep talking.
Well, so it sounds like the big things when you're sick, keep taking our meds, keep taking our insulin, and if able, keep eating. If we aren't able to eat, drink some carbohydrates so that we can maintain blood sugars.
Yes.
Okay. Well, I feel like for general sick day management, that kind of covers it. Do you want to pause here so you can go inside and then we can resume and talk about COVID specific?
Yes, that's a
Okay,
perfect plan.
let's do that. We'll stop here. We'll resume a second video in a couple of minutes.
Okay.
Okay.